Welcome to the practice test session. As usual, in this section, you will be given different situational questions, and you have to find out the best among the options provided. Situation 1. A 30-year-old was injured in an accident and has become a paraplegic. The client was advised to use crutches on a permanent basis by the physician. Which type of crutches would most commonly be used in this situation? Option 1. Forearm crutches. Option 2. Axillary crutches. Option 3. Platform crutches. Option 4. Leg support crutches. I will give you 10 seconds to go through the questions and select the answer. You can see the timer at the right-hand side of the screen. There is no need to worry if you cannot answer the questions in the meantime. You can pause the video and select the options. Well done. Now, let's see if your selected option is correct. Before that, let's understand what are crutches. Crutches are a type of walking aids that transfers weight from the legs to the upper body. The correct answer for this question is option number 1, that is forearm crutches. Forearm crutches have a cuff that encircles the lower arm. These types of crutches tend to be used for long-term use, such as with braces when a person suffers paralysis, instead of axillary crutches, which are for short-term use. What about option 2, or axillary crutches? Axillary crutches, or underarm crutches, are used to support a patient when one leg is almost entirely non-weight bearing. These crutches are commonly used for short-term purposes, such as while the patient is recovering from injuries or is weak from surgery. They are height adjustable. Option 3, platform crutches, are the one in which hand holds a grip while the forearm rests on a horizontal platform. Platform crutches are rarely used, especially by people with a weak hand grip due to conditions such as arthritis or cerebral palsy. Option 4, or leg support crutches, allow you to rest your knee or shin on their comfortable padded leg platform. Did you get that right this time? Don't worry if you couldn't, as we still have other questions for this section. By the time we complete the course, you would be in better position to solve the questions. Let's now start with another situational question. Situation 2. A nurse is assessing a patient with fractures of the medial ulna and radius, where she notes all of the following data. Which assessment finding should the assigned nurse report to the physician immediately? Your options are option 1. The patient complains of pain and pressure. Option 2. The skin is pink and warm to touch. Option 3. The cast is in place and is dry and intact. Option 4. The patient has sensation in finger and can move the finger. You can pause the video and select the options if you feel you need time to go through the questions correctly. Correct answer to this question is option 1. Compartment syndrome is a condition in which there is increased pressure in a muscle compartment, which results in insufficient blood supply to tissue within that space. Pressure and pain may be due to increased compartment pressure and indicate the serious complication of acute compartment syndrome. This is urgent. If not treated, cyanosis, tingling, numbness, paresis, and severe pain may occur. Other features mentioned in the options are normal findings. I hope you got that right. I request you to also watch my lecture on the related theoretical question if you need to revise the concepts. Let's go through another question for further practice. Situation 3. A nurse in charge is making assignments for the day shift. Which patient should she assign to the nurse who has been pulled from the post-anesthesia care unit for the day? Option 1. A 69-year-old patient with Paget's disease who has just returned from surgery for total knee replacement. Option 2. A 63-year-old patient with osteoporosis and a new orthotic device whose knowledge of use of this device must be assessed. Option 3. A 68-year-old patient with osteomalacia who is being discharged to a long-term care facility. Option 4. A 52-year-old patient with osteomyelitis who needs teaching prior to hyperbaric oxygen therapy. Let's see if you can get it right this time. As I always mention, you can pause the video and read the question again if you need more time. The correct answer to this question is option number 1, which is a 69-year-old patient with Packett's disease who has just returned from surgery for total knee replacement. The post-anesthesia care unit nurse is familiar with the assessment skills that are necessary to monitor a newly post-operative patient. The other patients need care from nurses familiar with musculoskeletal-related nursing care to provide teaching, assessment, and report to the long-term care facility. Next question. Situation 4. A patient with a herniated intravertebral disc undergoes a laminectomy and discectomy. Following the surgery, the nurse should position the patient on the side by. Okay, so you have to select the correct procedure for this question. Your options are option 1. Elevating the head of the bed 30 degrees and having the patient extend the legs while turning to the side. Option 2. Turning the patient's head and shoulders and then the hips, keeping the patient centered in the bed. Option 3. Placing a pillow between the patient's legs and turning the entire body as a unit. Option 4. Grasping the side rails and pulling the shoulders over. This question could be tricky. Think wisely. No hurry. You can pause the video and take your time. The correct answer to this question is option number 3. Log rolling is a technique used to turn a patient whose body must at all times be kept in a straight alignment like a log. This technique is used for the patient who has a spinal injury. Log rolling is used to maintain correct body alignment after laminectomy. The other positions will create misalignment of the spine. How are you progressing so far? The questions could seem a little difficult to solve at first, but don't panic. You will get used to the questions like this to get perfect by the time we are ready to sit for the exam.